Welcome back, everybody, as we take another look at the city of Houston. You know, we've seen recently that an emergency kit can make things a lot better if you have to leave your home in a hurry. As we approach hurricane season, we wanted to talk to a doctor about the things that we should be including in our emergency kit, things beyond just sort of food and water. So joining me now to talk about that is Dr. Aiden Alvarez with Lux Primary Care. Dr. Alvarez, thank you so much for joining us this morning.
Hi, thank you for having me.
All right, so I guess, like I said, you know, we've seen the importance of having an emergency kit beyond hurricane season. Hurricane season coming up in a few days, so we were kind of all sort of in that mindset of getting ready for hurricane season. But really, this is probably something we should be thinking about all the time.
Actually, yeah, it's good to be proactive and making sure that you have everything readily available. That way, there's not that last minute rush to the store to get everything that you need, last minute rush to the pharmacy to get refills, you know.
All right, so let's talk a little bit about, from the medical side of things, an emergency kit. You know, for our emergency kit at the house, I'm just kind of thinking off the top of my head the things that we have. But then, of course, the number one and number two things, food and water. But, you know, I take a statin every day. I certainly don't have that on the list of things to put in my emergency kit. I probably would leave home without it.
Well, yeah, so it is very important. Again, just to kind of be proactive and before a big storm hits, taking inventory and making sure that you have at least 1 to 2 weeks worth of medication is what I recommend. And if you don't, calling your doctor's office and trying to get some refills and.
Is it that simple, though? I avoid putting off getting refills until I actually need them. And if I called and said, hey, there's a potential hurricane coming up, can I go ahead and do that? And then the other thing, too, is do medications expire? I mean, should I be keeping my mind on that as well?
So generally, medications expire about a year after being dispensed. So if you're keeping up to date with your medications and you're getting them filled regularly, the expiration date on the medication shouldn't be a big issue for things like statins. Other things like, for example, an EpiPen, right? That's something that we like to keep on hand. Does have an expiration date, but is not commonly used. It is a good idea to go through and make sure that that those medications haven't expired. Breathing treatments, for example, are another thing that you keep there in case you need it, but you don't always use it. So it's good to make sure that those medications haven't expired either.
And what about people with chronic conditions? Like, what should they be doing?
So for chronic issues, I mean, it really kind of depends on what medical issues they have. So a lot of medications now are pill based. So as long as you keep them at room temperature, you're good. Other things like insulins in diabetics, for example. Generally, it's recommended that those are stored in the refrigerator, but they can actually be used up to a month at room temperature. So, nitrates for patients with chest pain. Those should be stored in the refrigerator, but are okay to keep out, for a couple of weeks.
Sure. All right, let's talk a little bit about then first aid things that you should have in your hurricane kit. Again, thinking just what we have in ours. I know we've got, some alcohol wipes and some bandages and stuff like that. Or anything else that we should be having in there or thinking about having in there beyond just sort of the basics?
Well, so what I generally recommend is for patients, to go get a good first aid kit because they'll have all the basics in there, like you mentioned, things for, cuts, scrapes, any allergic reactions, bug bites. But what you should be focusing on more is kind of tailoring it to your needs and your family's needs, right? So making sure that you have things like an EpiPen in case you have a history of severe allergic reactions. Making sure that you have other medications in there that aren't usually included, things like Vaseline, allergy medicine, so like some Zyrtec and Benadryl, some hydrocortisone cream in case you get rashes, things like that to just kind of supplement what is already there in those commercially available kits.
What do you see that are common mistakes people make that they don't include in their kit that maybe they should?
Well, the biggest mistake are those expiration dates that we talked about earlier. So a lot of people will buy a first aid kit and keep it around and not use it for a year or two. And a lot of those things expire, including the things in there like gauze, some of the medications that are in there. So making sure that you go back, check the expiration dates, and make sure that everything is up to date. The other thing that I see a lot is, people will take something out of it, and then they won't replace it.
Yeah.
So, you know,
Yeah, I know
so you
about
need to
that.
make sure
Sure.
that you have everything in there, you know, that you're going to need. So replacing items as they're used is another big thing.
All right, Dr. Aiden Alvarez, Lux Primary Practice. Thank you so much for joining us. I do appreciate it.
Thank you so much.